Did you know that October is Breast Cancer Awareness Month? And did you know that the diagnosis rate of breast cancer is increasing? And that's due in part to the rising rate of obesity, women having children later in life, and having less children. Did you know that young women under 40 make up about 5% of breast cancer diagnoses, but their breast cancers tend to be more aggressive than women over 40? Did you know that men can get breast cancer too? And did you know that African American women are typically diagnosed at a younger age and later stage than other races of women, and we're more likely to die from the disease? The good news is that the death rates for all races of women is decreasing, and that's due in part to early detection and advancements in treatment. Hi, I'm Karla, and I am a stage 4 breast cancer survivor and author of the Amazon best-selling breast cancer memoir, Dig in Your Heels. I'm here to share information with you about prevention, early detection, and knowing your risk. My hope is that you will share this video far and wide, share it with everyone who has breasts and anyone who comes into contact with them. My motto in life is one life to live, many lives to touch, and I'm sure this information will save lots of lives and a lot of breasts too. Let's talk early detection. The earlier you can detect breast cancer, the better your chances are of surviving. It's important that you know your breasts so that you know if something's out of the ordinary. I recommend that you do monthly breast self-exams, especially if you're under the age of 40. I found my breast cancer myself, and I was diagnosed at the age of 34. The recommended age for getting mammograms is 40. I would have waited 6 long years before I ever would have detected that I have breast cancer if I wasn't doing my breast self-exams. When you do your breast self-exam, don't forget to squeeze. My tumor was not detectable doing the typical feeling around for a pebble. You had to squeeze. Sometimes a spouse, partner, lover, what have you, I don't judge, might find a breast cancer in a woman because they are not feeling around for a pebble. They're squeezing. If you're 40 years of age or older, get regular mammograms every year. Don't miss a year. If you're under the age of 40 and you have a family history of breast cancer, mammograms might be covered for you prior to turning 40. When you get your mammogram, be sure to ask if you have dense breasts. Breast cancer is harder to detect via mammogram in dense breasts. You might need further testing. Remember, you don't always have to have a lump to have breast cancer. If you notice any of these following symptoms in your breast or your loved one's breast, make sure to get it checked out with your doctor right away. Swelling of part or all of your breast, nipple discharge, an inverted nipple, unusual breast or nipple pain, skin irritation or dimpling, redness, scaling, or thickening of the nipple or breast, swelling under the arm, your breast feeling warmer than usual. Keep in mind that there are non-cancerous conditions that can cause some of these symptoms, so don't panic, but be sure to get it checked out, knowing your risk. I call this the uncontrollables. Menstruating before the age of 12 increases your risk of getting breast cancer. Having children after the age of 35. The number of children you have affects your risk. The more children you have, the lower your risk. The later you go into menopause increases your risk of developing breast cancer. If you have a first-degree relative with breast cancer, that's a mother, sister, or daughter, your risk of developing breast cancer is higher. Genetics also play a part. If you have a genetic mutation such as BRCA1 or BRCA2, and there are others as well, you have an increased risk of developing breast cancer. Also, if you have dense breasts or have had radiation exposure to the chest, you have an increased risk of developing breast cancer. You should talk to your doctor and let them know about the risk factors that you have that may increase your chances of developing breast cancer. Let's talk prevention. I call these the controllables. The following things will help you lower your breast cancer risk. Maintaining a healthy weight. Maintain a healthy diet. The more fruits and vegetables, the better. Smoking is linked to breast cancer. So if you smoke, please stop. And if you don't start. Limit your alcohol. Have Having 2 or more alcoholic beverages daily can increase your risk of getting breast cancer. Avoid hormone replacement therapy, or HRT. Get your vitamin D. This is particularly important for people with dark skin and for people who live where there's not a lot of sunshine. Exercising. 75 to 150 minutes of brisk walking each week can help lower your breast cancer risk. There you have it. That was your Karla Living public service announcement for Breast Cancer Awareness Month. I've added breast cancer resources to my website, karlaliving.com, in case you need more information. Thank you for tuning in. Please like, share, and comment on this video, and let me know if you learned something new or if this information was helpful. Follow me on social media, subscribe to my blog, subscribe to my YouTube channel, and be inspired as I live my best life and encourage you to do the same. And please keep me in your thoughts and prayers as I battle breast cancer for the 3rd time. I'm Karla Batiste. I have one life to live and many lives to touch, and I hope I touched your life today.